There is a particular cruelty in a disease that announces itself quietly, that moves through the body for months or years, leaving signs that are easy to miss, easy to explain away, easy to absorb into the background noise of ordinary aging and never examine closely enough to recognize for what they actually are. Diabetes, specifically type 2 diabetes, is that kind of disease. It does not arrive with the unmistakable urgency of a heart attack or the sudden and frightening clarity of a stroke. It arrives incrementally, in sensations and changes that feel almost mundane, almost reasonable to attribute to getting older, or to being tired, or to any of the dozen other explanations that present themselves to a person who is not specifically looking for the signs of a serious metabolic condition. And for adults over 60, this incrementality is particularly dangerous because the normal experiences of aging provide so many convenient explanations for symptoms that might, in a younger person, more quickly prompt a medical evaluation. The statistics surrounding diabetes in older adults are among the more sobering in all of public health. Approximately 1 in 4 adults over the age of 65 in the United States has diabetes, making it one of the most common chronic conditions in this age group. Even more significant from a public health perspective is the additional substantial proportion of older adults who have prediabetes, a condition in which blood sugar levels are elevated above normal but have not yet reached the threshold for a diabetes diagnosis, and who are on a trajectory toward full diabetes if nothing changes. Studies have consistently found that a meaningful proportion of older adults who are eventually diagnosed with type 2 diabetes had the condition, undetected, for an average of 7 to 10 years before diagnosis. 7 to 10 years during which the elevated blood sugar was silently damaging blood vessels, nerves, kidneys, eyes, and other organs, during which the person had no idea what was happening, and consequently had no opportunity to intervene and prevent that damage from accumulating. Understanding why diabetes goes undetected for so long in older adults requires understanding the specific way this condition develops and the specific ways its early and middle stage symptoms manifest differently in older people than in younger ones. Type 2 diabetes develops when the body's cells become increasingly resistant to the effects of insulin, the hormone that normally allows glucose from food to enter cells and be used for energy. As insulin resistance increases, the pancreas compensates by producing more insulin to achieve the same blood sugar lowering effect, and for a period of time, this compensation is sufficient to keep blood sugar levels within the normal range. Eventually, the pancreas cannot keep up with the demand. Insulin production begins to decline, and blood sugar levels start to rise, initially into the prediabetes range and then into the diabetes range. This gradual progression means that blood sugar levels are creeping upward over years, producing effects on the body that are subtle in the early stages rather than dramatic. The classic symptoms of diabetes that most people have heard about, extreme thirst, frequent urination, dramatic weight loss, and extreme fatigue, are symptoms of significantly elevated blood sugar and may not appear until the condition has been present for years and blood sugar has risen to quite high levels. In the meantime, the condition is communicating its presence through quieter, more ambiguous signals that require attentive listening to recognize. What follows is a careful and detailed look at 9 of the most commonly overlooked silent symptoms of diabetes in older adults, symptoms that individually might seem to have innocent explanations, but that together, or in context of the risk factors that make diabetes more likely, deserve to prompt a conversation with a healthcare provider and a simple blood test that can determine whether diabetes or prediabetes is present. These symptoms are not presented to cause alarm, but to provide the kind of clear information that allows people to make informed decisions about when to seek evaluation, rather than waiting until the condition has advanced to a stage where more damage has already been done. The first silent symptom is increased fatigue that seems disproportionate to activity levels and that does not resolve with adequate rest. This is perhaps the most commonly overlooked symptom because fatigue is so universal, so frequently attributed to the demands of daily life, stress, poor sleep, or simply the general experience of getting older, that it rarely prompts specific concern. But the fatigue of elevated blood sugar has a specific character that comes from a specific mechanism. When cells are unable to effectively use glucose for energy, either because of insulin resistance or because insufficient insulin is available, the body is quite literally energy starved at the cellular level despite having an abundance of glucose in the bloodstream. The resulting fatigue is often described as a deep and persistent tiredness that is different from ordinary tiredness, a heaviness or fogginess that sits underneath daily life rather than lifting after a good night's sleep. For older adults who already experience some fatigue as part of the normal aging process, distinguishing the fatigue of undiagnosed diabetes from background aging-related tiredness requires paying attention to whether the fatigue represents a meaningful change from a person's previous baseline, whether it is accompanied by other symptoms on this list, and whether it seems to follow meals in a way that might reflect blood sugar fluctuations. The fatigue that worsens notably after eating a meal high in refined carbohydrates and then improves somewhat a couple of hours later can reflect the blood sugar spike and subsequent crash that characterizes insulin resistance. And this pattern, while not diagnostic on its own, is a signal worth noting and discussing with a healthcare provider. The second silent symptom is increased thirst and more frequent urination, symptoms that are technically among the classic indicators of diabetes, but that are so frequently explained away in older adults as consequences of other conditions, medications, or simply aging, that they often fail to prompt appropriate investigation. When blood sugar rises above a certain threshold, the kidneys attempt to filter the excess glucose out of the blood by excreting it in the urine, a process that requires taking significant amounts of water along with the glucose, which is why elevated blood sugar produces both increased urination and, consequently, increased thirst. The increased urination that results can be easily attributed in older adults to prostate issues in men, to bladder problems in women, or to the effect of diuretic medications that many older adults take for blood pressure or heart conditions. The increased thirst can be attributed to weather, to increased activity, or to any number of other explanations. What makes these symptoms worth paying closer attention to is their pattern and their persistence. Waking multiple times at night specifically to urinate, needing to urinate very frequently during the day in a way that represents a meaningful change from previous patterns, and experiencing thirst that feels difficult to satisfy, these are patterns that rise above the level of simple background variation and that deserve specific evaluation rather than routine explanation. In the context of other symptoms on this list, or in the context of risk factors for diabetes, including excess weight, family history, or previous gestational diabetes, these symptoms should prompt a conversation about blood sugar testing rather than ongoing acceptance as simply part of aging. The third silent symptom is slow or difficult wound healing, which is one of the more striking and more diagnostically useful symptoms of diabetes when it is recognized, but which is remarkably often attributed by both patients and even healthcare providers to poor circulation, to skin changes associated with aging, or to other local factors rather than to the systemic effect of elevated blood sugar. Elevated blood sugar impairs wound healing through multiple mechanisms. It damages the small blood vessels that supply nutrients and oxygen to healing tissue. It impairs the function of immune cells that would normally protect wounds from infection and coordinate the healing process. It alters the environment of tissues in ways that make the biochemical processes of wound healing less efficient. The result is that cuts, scrapes, bruises, and particularly wounds on the feet and lower legs heal significantly more slowly than they should in people with poorly controlled blood sugar. For older adults, this symptom is particularly significant because slow wound healing on the feet can progress to serious infections and even to tissue death in severe cases, representing one of the most devastating complications of undiagnosed or poorly controlled diabetes. The feet deserve particular attention in this context because many older adults have some reduced sensation in their feet. That means they may not notice minor injuries promptly, and because the combination of poor wound healing with delayed injury detection creates conditions in which wounds can progress significantly before they are recognized and treated. Any wound that is not healing at the expected rate, particularly on the feet or lower legs, deserves prompt medical attention and should prompt consideration of blood sugar evaluation if this has not been recently performed. The fourth silent symptom is frequent infections, particularly certain types that have a specific relationship to elevated blood sugar. The immune dysfunction caused by high blood sugar creates an environment in which certain types of infections are more common, more severe, and more difficult to treat than they would be in someone with normal blood sugar. Urinary tract infections are among the most common of these, and older adults, particularly women, who experience recurrent urinary tract infections that keep returning after treatment, may be experiencing this pattern partly because of elevated blood sugar, rather than simply because of anatomical or other factors usually invoked to explain recurrent urinary tract infections. Fungal infections, including yeast infections affecting the skin folds, the genital area, and the mouth in a form called oral thrush, have a particular relationship to elevated blood sugar because fungi thrive in the glucose-rich environment that high blood sugar creates. Skin infections, including infections around the hair follicles and infections in areas where skin meets skin, are also more common in the context of elevated blood sugar. The pattern that should prompt specific concern is not a single isolated infection, which can have many causes, but recurrent infections of similar types, infections that are unusually severe or unusually difficult to treat, or infections that keep returning after apparently successful treatment. Any of these patterns in the context of other symptoms or risk factors for diabetes deserves evaluation of blood sugar as part of the diagnostic workup. The fifth silent symptom is vision changes, specifically blurred vision that fluctuates and that may worsen when blood sugar is elevated and improve when blood sugar falls back toward normal. This symptom is produced by the effects of changing glucose levels on the lens of the eye, which changes shape in response to osmotic effects of blood sugar fluctuations, and which consequently changes the focal length of the eye in ways that produce blurring. This blurring is often attributed by older adults to changing prescriptions in their glasses or contacts, to eye strain, to dry eyes, or to the general vision changes that aging brings, and the connections to blood sugar fluctuations are rarely made because most people do not have ready access to information that would connect these two phenomena. Beyond this relatively benign and reversible blurring, elevated blood sugar over time causes more serious and potentially irreversible damage to the blood vessels of the retina in a condition called diabetic retinopathy, which is one of the leading causes of blindness in adults. This damage develops silently over years without causing noticeable symptoms until it has progressed to a stage where vision loss may be difficult to reverse, which is why regular eye examinations that specifically evaluate the retina are so important for people with diabetes and for people at high risk. Any vision changes that seem to fluctuate, that cannot be fully corrected by current glasses or contact lenses, or that represent a meaningful change from previous vision, deserve evaluation that includes consideration of blood sugar status. The sixth silent symptom is numbness, tingling, or pain in the hands and feet, which reflects the nerve damage called peripheral neuropathy that elevated blood sugar causes over time. The nerves that supply sensation and motor function to the extremities are particularly vulnerable to the toxic effects of chronically elevated blood sugar, and the damage to them produces a characteristic pattern of symptoms that typically starts in the feet, often described as tingling, burning, pins and needles, numbness, or pain, and that may progress up the legs over time. The same pattern can affect the hands, producing symptoms that travel up the arms. In older adults, this symptom is perhaps the most commonly misattributed of all the silent symptoms of diabetes, because peripheral neuropathy has multiple possible causes, and because nerve symptoms in the extremities are frequently attributed in older adults to circulation problems, to arthritis, to sitting in positions that compress nerves, or to generalized aging-related changes in nerve function. While all of these alternative explanations can indeed produce numbness and tingling, diabetes-related peripheral neuropathy is so common and its early treatment so important for preventing progression that blood sugar evaluation should be part of the assessment of any unexplained numbness or tingling in the extremities in an older adult, particularly if accompanied by other symptoms on this list. The specific danger of neuropathy in the feet extends beyond the unpleasant sensations themselves to the functional consequences of reduced sensation. When sensation in the feet is diminished, minor injuries may go unnoticed until they have progressed to serious wounds. The walking and balance problems that can accompany peripheral neuropathy increase fall risk. And the combination of poor wound healing discussed earlier with reduced sensation creates particularly dangerous conditions for foot health that represent one of the most serious preventable complications of uncontrolled diabetes. Any unexplained changes in sensation in the feet or hands, any new pain, burning, or numbness in the extremities deserves evaluation rather than acceptance as simply part of getting older. The seventh silent symptom is unexplained weight changes, and specifically for older adults, unexpected weight loss, rather than the weight gain that many people more commonly associate with diabetes. While weight gain and obesity are significant risk factors for the development of type 2 diabetes, undiagnosed diabetes can itself cause weight loss in certain circumstances, particularly when blood sugar is very elevated and the body is unable to effectively use glucose for energy, causing it to break down muscle and fat for fuel instead. This weight loss in the context of elevated blood sugar can be wrongly welcomed initially, particularly if a person has been trying to lose weight, and the metabolic explanation for it may not be recognized until other symptoms or a blood test reveal the underlying blood sugar elevation. More subtly, older adults with prediabetes or early diabetes may experience changes in body composition, specifically a shift toward more fat storage around the abdomen accompanied by muscle loss that may not register as significant weight change on the scale, but that is metabolically meaningful and that can itself drive further insulin resistance in a cycle that progressively worsens the metabolic picture. Paying attention to whether body shape is changing in ways that involve increasing abdominal girth, even without significant changes in total weight, is a form of self-monitoring that can provide useful early information about metabolic trends worth discussing with a healthcare provider. The eighth silent symptom is cognitive changes, specifically difficulties with memory, concentration, and mental clarity that may reflect the effects of blood sugar fluctuations on brain function. The brain is exquisitely sensitive to glucose availability and to insulin signaling, and both chronic elevation of blood sugar and the fluctuations between high and low that can characterize poorly controlled diabetes have direct effects on cognitive function that researchers have been documenting with increasing detail in recent years. In the short term, elevated blood sugar is associated with slowed thinking, difficulty concentrating, and memory lapses that improve when blood sugar returns toward normal. Over the longer term, chronically elevated blood sugar is associated with increased risk of cognitive decline and dementia through the vascular and inflammatory mechanisms already well established in the hypertension research discussed earlier in this series. For older adults who are already navigating some normal age-related slowing of cognitive processing, the cognitive effects of blood sugar dysregulation can be particularly difficult to distinguish from the background of normal aging or from the early signs of primary neurodegenerative conditions. The specific pattern that might suggest a blood sugar connection includes cognitive symptoms that seem to fluctuate, that are worse at certain times of day, that seem to correlate with eating patterns, or that are accompanied by other symptoms on this list. Any meaningful change in cognitive function deserves medical evaluation regardless of its cause, and blood sugar assessment should be part of that evaluation, given how common diabetes is in older adults and how directly it can affect brain function. The ninth silent symptom is skin changes, including a specific condition called acanthosis nigricans, that is a direct visible marker of insulin resistance, as well as more general skin changes including unusual dryness, itching, and slow healing skin conditions. Acanthosis nigricans, while its name sounds intimidating, simply refers to the development of darkened, velvety patches of skin in body folds and creases, most commonly at the back of the neck, in the armpits, and in the groin. These patches are caused by the effects of elevated insulin levels on skin cells, which causes them to proliferate and produce increased pigment, and their presence is a direct visible sign of the insulin resistance that precedes and accompanies type 2 diabetes. Many people notice these patches and attribute them to dirt that does not wash off, or to sun-related skin changes, without realizing that they are looking at a metabolic signal worth discussing with a healthcare provider. More general skin dryness and itching can also reflect the dehydrating effect of elevated blood sugar and the circulation changes that diabetes causes in the small vessels supplying the skin. Skin conditions that persist unusually long, that recur frequently, or that respond poorly to treatment may have a diabetes-related component worth evaluating. The critical practical message that emerges from understanding these 9 silent symptoms is not that every person experiencing any one of them has diabetes or should panic. Many of these symptoms have multiple possible causes, most of which are neither diabetes nor anything else requiring urgent intervention. The message is rather that the combination of symptoms, the persistence of symptoms, and the presence of symptoms in the context of known risk factors for diabetes, including age over 60 itself, excess weight particularly around the abdomen, a sedentary lifestyle, a family history of diabetes, high blood pressure, high cholesterol, or a previous diagnosis of prediabetes should lower the threshold for seeking evaluation and specifically for requesting blood sugar testing. The tests used to diagnose diabetes and prediabetes are simple, inexpensive, and widely available. A fasting blood glucose test, a hemoglobin A1C test, which provides information about average blood sugar over the preceding 2 to 3 months, and an oral glucose tolerance test are the primary diagnostic tools, and most can be ordered as part of routine blood work. The American Diabetes Association recommends screening for diabetes in all adults over the age of 45, with more frequent or earlier screening for those with additional risk factors, and yet a substantial proportion of older adults have not been recently tested, whether because the conversation with their healthcare provider has not come up or because they have declined testing out of fear of what it might reveal. This fear deserves direct acknowledgement and direct challenge. The fear of a diabetes diagnosis, the reluctance to find out something that might be frightening to know, is understandable and human. But it operates on the same backwards logic discussed in the context of blood pressure, which is that the conditions most worth finding early are precisely the ones for which early detection makes the greatest difference in outcomes. Type 2 diabetes found early, in the prediabetes stage, or in its early stages, before significant complications have developed, can in some cases be reversed entirely through lifestyle intervention, and when not fully reversed, can be very effectively managed with the combination of lifestyle changes and medication that prevents the development of the complications that make diabetes a genuinely devastating disease. The complications themselves, the kidney disease, the blindness, the nerve damage, the cardiovascular disease, the amputations that represent the worst outcomes of uncontrolled diabetes, are largely preventable with early and effective management. Finding the condition early makes all the difference between a diagnosis that changes how you live but allows you to live well, and a diagnosis made late after complications have already established themselves that is genuinely limiting in ways that might have been prevented. The truth about diabetes in older adults is that it is common enough and silent enough and serious enough in its potential consequences to warrant proactive engagement rather than passive waiting for symptoms dramatic enough to be impossible to ignore. Understanding the 9 silent symptoms described here and understanding the risk factors that make diabetes more likely provides the foundation for making the informed decision to seek evaluation rather than waiting. A simple blood test can provide information that changes the trajectory of years and potentially decades of health. The silence of diabetes before it announces itself through major complications is not reassurance. It is the very reason to listen more carefully for the quiet signals it sends along the way.